Income insecurity is a growing concern for many individuals and families in Antigonish and across Nova Scotia. Despite our hardworking communities, Nova Scotia faces the third highest cost of living in Canada. We also have the highest poverty rate among all 10 provinces, with 13.1% of people living below the poverty line, regardless of age. Wages remain low, and while the province plans to raise the minimum wage to $16.50 an hour on October 1st, it's still far from enough. In Antigonish, the living wage, the income needed to cover basic expenses, is estimated at $24.30 an hour. That's a significant gap. On top of that, many jobs are seasonal, temporary, or part-time, leaving workers without stability. Income assistance rates in Nova Scotia are also among the lowest in the country, offering little relief for those struggling to get by. Right now, 1 in 3 individuals or families across Canada is facing financial hardship. The need for change is clear.
My name is Colleen Cameron. I'm a member of the Antigonish Coalition to End Poverty. I have been for a number of years. I'm involved with food security and community garden boxes. And I've been involved with the Antigonish Affordable Housing Society for a good number of years as chair of the board.
My name is Anita Stewart, and I'm the Executive Director of the Antigonish Women's Centre and Sexual Assault Services Association. So unfortunately at this time of year there are many stories that I could tell. Quite often what people find themselves doing, especially people that are living with in poverty or have low income, they're not able to pay their power bills. So they tend to let those lapse over the winter months. We do have many people coming to the centre saying that we've received a disconnection notice from Nova Scotia Power. Are you able to help me? Which is really sad. People are having to decide whether or not they're going to pay their power bill, put food on the table, pay for their medication, and multiple things, the basic necessities. So it's very unfortunate.
Well, there are many stories, but there's one that somebody told me that really sticks out with me, and it was a story of this woman who was grocery shopping. She had a gift card, and she was going through the checkout and gave them the gift card. And she had got some hot dogs, some chips and pop and ice cream. And the one at the checkout said, "Is that what you want to spend your money on, using this gift card for junk food?" And she walked out because she was getting ready for a birthday party. And every time I think about that, I really get emotional. Because of that pain and the stigma of people who live in poverty, I'd say that's probably the biggest challenge. Anybody living in poverty has faced a lot of stigma, but again, so many challenges of just trying to live from day to day and day to day, week to week, and it just affects them in so many ways, Being on low income is you're often not seen. You're living in areas where not everybody goes, that kind of thing. The stress of day-to-day survival is a big challenge that people on low incomes will face. Where are they going to get the money to buy the food? Every time you spend money, you really have to think, can I afford to do this? Could I put it on something else?
So poverty is one of the social determinants of health, and unfortunately poverty affects all of us, even if we ourselves aren't living in poverty. There's increased stress on families, there's increased mental health issues, and sometimes there may be increased use of substance misuse or abuse. And if that's taking place in the family home, then not only is the individual being affected, but also the rest of the family, especially children. People are finding themselves in a position where they may not be able to afford medications or just being able to put food on their table. Because people living in poverty are at a higher risk for chronic diseases, they will need more health care, and that obviously puts a strain on our healthcare system. Quite often, people that are living in poverty suffer from mental health illnesses because of the sheer nature of poverty and what that means to them. They may be anxious, which then may lead them not being able to get to work every day, which then is a perpetual cycle of not bringing money into the home, which is very discouraging, and it's that cycle of, unfortunately, of poverty.
I know many people that are on low income that are often going to emerge or in the healthcare system. Some of them have chronic diseases. Some of them have mental health challenges. If you look at any research, people on lower income have to access the healthcare services much more than others. Yeah, we could be spending more of our income on making sure people don't live in poverty, and would save a lot more money on our healthcare system. If people didn't live in poverty, our healthcare system would be working much better than it is today. So.
It's been talked about for many years, but there's this basic income that people should be receiving or should be earning. When we look at the minimum wage at between $15 and $16, and then we look at what it takes to actually live and sustain oneself, it certainly takes a lot more than that minimum wage. So there should be like a basic income, which would certainly be beneficial to people, to all people, whether you find yourself living in poverty now, or you're moving out on your own, leaving your parents' home. There should be a basic income.
There's more and more people struggling with affordability, with lack of income. People have very low income because that's the policies that we have in place. That's what the policies our government puts in place. If you're on income assistance, you're living below the poverty line. If you're on disability, you're living below the poverty line. Giving people more income in their hands would really make a big difference. Then you wouldn't have food banks and pantries and that kind of thing, A basic income guaranteed for everyone. Everyone that requires it. If everyone had a basic level of income, we wouldn't have people that have food insecurity. They would have enough money to pay for their rent that they would need. They would have enough income throughout the year so that they could work seasonally and make good income, and then be supported for the rest of the time while there is no seasonal work available. And support their families, look after their elderly parents, or do all kinds of things. So a basic guaranteed income would take the vast majority of people out of poverty. And poverty costs us a lot of money in many ways. So we could save money in the long run if we had a basic guaranteed income.
So one of the policy changes that I would like to see is access to affordable education. And the reason for that is when people obviously gain skills or education, they are then more employable and hopefully are able to find gainful employment, bringing in money that will help sustain them and their family. It's so important not only for financial reasons, but just for mental health reasons, to be out there feeling like you're engaging in work and that you are contributing to society. It just makes us feel better about ourselves. So that would be one policy change. There's so many. Like I said, the basic income would be another, just to name a few. There needs to be economic stability for people living in poverty, whether it be to free education, subsidized childcare, affordable housing, and not just affordable housing, but affordable safe housing. access to transportation. Poverty affects the community as a whole, and not just our community, but our province and our country. And economic stability, if we provide that to people, we'll just have richer communities. And our systems, that our social security systems, there won't be such a strain on that because so many people are struggling.
We are all part of this community together, and we need to be supportive of each other. If somebody is struggling, that is affecting us as a community. So we need to see each other as our brothers and our sisters, to be empathetic and supportive and be open to everyone in our community.